Welcome. In this episode, an update on the coronavirus crisis.
Advice on flattening the curve, staying fit, and protecting the vulnerable. I'm Akira Redman.
I'm Yvonne Redman. This is Pandemic News.
We begin with an update on the pandemic, the effects of which are being felt around the world. Dr. Oscar Lent, a leading infectious disease expert, is on the line. Hello, Dr. Lent. Thank you for joining us.
My pleasure.
Dr. Lent, are the infection rates increasing or decreasing?
As we all know, COVID-19 has spread throughout the world, and yes, the number of cases and deaths are increasing rapidly. Sadly, right now, the only thing we can recommend is social distancing and self-quarantine for the infected. Frankly, there are no indications infection rates will decrease anytime soon. But many have recovered from this virus, so that's a good sign.
Where are the biggest outbreaks?
The number of outbreaks have been increasing for a while now. Some countries, such as Italy, Spain, and the United States, and of course China, have been more affected than others. There are now more than 1 million cases worldwide.
So, COVID-19 continues to spread.
Yes, it's spreading rapidly. Many are getting infected by this virus, but even non-infected people are impacted. As you know, many schools are closed, and most, if not all, social events and public gatherings are canceled. Many are wondering when this virus will dissipate so things can get back to normal. But it's still too early to tell.
Thank you. Thank you very much, Dr. Lent.
My pleasure. Bye-bye now. I'll be back to my tri-moto.
To know how to prevent the spread of COVID-19 is to know how it spreads in the first place. Joining us is Dr. Pickles with the latest on how the virus spreads and what we can do to protect ourselves and others. Hello, Dr. Pickles. Are you there?
Yes, I am. Thank you for having me.
Dr. Pickles, could you tell us more about this virus and how it spreads?
Why, yes, of course. The novel coronavirus spreads when somebody coughs or sneezes, and respiratory droplets containing the virus enter through the airways or eyes, then travel to the lungs.
So that's how people get infected. How does someone know they've got it?
That's a great question. Symptoms include fever, coughing, shortness of breath, and breathing difficulties. But it depends on the individual if symptoms are mild or severe. Severe cases can lead to kidney failure, pneumonia, and severe acute respiratory syndrome, commonly known as SARS. Many of these complications are fatal if left untreated.
I see. Are there ways to prevent the transmission of the virus?
It is very important to try and contain this virus. Here are some ways to prevent the spread. Wash your hands thoroughly. You should be able to say the ABCs before finishing. That's at least 20 seconds, you know. Avoid touching the face and eyes. Keep frequently touched surfaces clean, such as doors, handles, counters, remotes, light switches, and so on. Use a clean cloth and a disinfectant cleaner. Social distancing is also very important. This virus is extremely contagious. People should keep a distance of at least 6 feet apart. Stay home if you're not sick. Self-quarantine if you feel ill, and seek medical attention immediately if the symptoms become severe.
Thank you very much, Dr. Pickles.
Thank you for having me.
Physical health is important, but even more so during this pandemic. Daily exercise is necessary to burn the extra calories gained by sitting around or stress eating. Unhealthy habits may lead to sickness and an increased risk of becoming infected with coronavirus. A situation like this pandemic could have you in a hospital bed for longer than you'd have to be. That's why you should use this time to exercise while keeping a good distance from others. And of course, consider indoor exercise instead of venturing out to parks or other public places.
Not only is it good to stay physically healthy during the pandemic, but it is also important to stay mentally fit. If you live alone and are having feelings of loneliness, this may lead to depression. Try to stay calm and keep a positive state of mind. If you are feeling down, we suggest staying in contact with others, using the internet or phone, or watching a meditation video on YouTube to help you cope.
As we now know, elderly people are more susceptible to coronavirus. So why is this? At an early age, people can recover from diseases more easily because their immune systems are stronger. But as many of us age, we tend to have lower immune systems. Therefore, many older people are more vulnerable to diseases and the health complications they can cause. Sadly, seniors who are over the age of 80 have a greater chance of dying. Younger adults, teens, and children, try to help prevent your parents and grandparents from getting this virus. Offer them assistance. Have one person go and get groceries and medicine. Preventing an elderly person from becoming infected could mean the difference between life and death. So anyone with an elderly family member or neighbor, please help keep them safe. That's today's show. I'm Akira Redmond. Take care and be well.
And I'm Yvonne Redmond. Thanks for joining us. Stay safe.